Am I audible? Is the screen clear so that we can start the session? Let me just check. Okay, so let me just check. Then we can start the session now. Okay, so the screen is clear and I am audible. Okay, so we can start the session. So, okay, quickly we will solve the MCQs related to head and neck topic so that you can revise the important MCQs targeted for your NEET PG 2022 examination. So, my dear aspirants, today I have catered total of 25 MCQs and I want everyone to be present live so that we can just cover all these MCQs. Okay. So, done with this, let's start with the topic, and before that I would also like to tell you about the important features of Unacademy and about myself. Okay. So, yes, my dear aspirants, so myself Dr. Monalisa, I have done my MD Anatomy from Armed Force Medical College, Pune, and these are our special sessions which is going to be always taken on the platform of Unacademy, which is highly beneficial for you. I just want you to know that these sessions benefits are that you can have an interaction live with the educators. You can raise your hands and get your doubts clear right itself when the session is going on. Never ever miss a session. What does that mean? That means that you are not going to miss any of the session, because if you start following the educator on the Unacademy app, you will get notification regarding all the sessions taken by that educator. So that is the plus point. So once the session is finished, you can also download the PDF notes, and this is the another key point and a beneficial point. Anywhere, anytime, read from the top educators of Unacademy platform. I would also like to, yes, Ayushman Patra, good afternoon, dear. You can also just note down the free session which I am going to take on Sunday. So please note down, on Sunday, that is 30th of January, 1 p.m. and 2 p.m. two sessions will be taken by me. That is high yield anatomy MCQ, that is targeting for NEET PG 2022 examination. The students who are watching this session for the first time, or they are downloading the Unacademy app for the first time, they should use my code ANAT10 and get enrolled for this free test. Akshay Kumar, good afternoon, dear. I would also like to share the whole timetable on the calendars for the NEET PG test. I am enlarging this image so that you can have a better view, and for that you can use the code ANAT10. So for that you can use the code ANAT10 and you can enroll in this session. This will be highly beneficial for you. So next session is on 30th January, that is 9 a.m. FMG 22 grand test. So Bikram class, okay, welcome to the session, my dear aspirants. And let's talk about plus subscription. When I am talking about the plus subscription, all 19 subjects will be completed in a very systematic way. You can study from India's top educators, and you can compete in live tests and quizzes. You can boost your own preparation. You can study on the device of your choice. And my dear aspirants, more than 25,000 high yield MCQs, clinical MCQs from all 19 subjects can be targeted by you. This will be highly beneficial for you. So all these questions will be clinical MCQs. Now coming soon, and you will get the printed notes of Unacademy. My dear aspirants, I would also like to talk about Iconic subscription, where the merging of Prep Ladder and Unacademy has been done. So you can be the part of clinical integrated essentials, video lectures from the Dream Team, or Prep Ladder video lectures, QBank 3 active guidance tag tracer, dream notes or printed notes of the Prep Ladder. All these benefits can be targeted by you, and this will be highly beneficial. So go for it. Use the code ANAT10 for getting additional 10% discount. Now, congratulations to the toppers of FMG December session 2021. I am very glad to share their images with you. Best of luck to them, and I want that they should target their NEET PG examination for the first attempt and get a best rank and very good rank. All the best for their examination. I would also like to tell you about the NEET PG. So Iconic and Plus pricing details. So in this slide you can compare the pricing detail of Iconic and Plus, which is shown here, and this will help you to decide which subscription you have to take. If you are at targeting next exam, NEET PG, INI-CT, definitely go for Iconic subscription. Use my code ANAT10 for additional 10% discount. Okay, so highly effective QBank is there on the platform of Plus course of Unacademy, that is more than 25,000 high yield clinical MCQs based on latest pattern of exam, and includes a detailed explanation provided to each and every MCQs by our top educators. So go for it, enroll for this test and enroll for solving all these MCQs by using the code ANAT10. You can get an extra discount of 10%. My dear aspirants, before starting the MCQ session, I would like to show you this image. Why? Because you must be wanting to know which sessions are right now going live on the Plus course. The two courses are right now going on. One is the Focus FMG Batch 22 Comprehensive Batch, and the other is the Target NEET PG 22 batch. So you can be the part of each one of this, and whichever suits you, so go for it, and your subscription will get an additional discount of 10% by using the code NAT10. Okay, my dear aspirants, so let's start with the MCQ session. So my dear aspirants, the first MCQ. So I will just wait for 30 seconds. Otherwise, if anybody of you are giving the answers, it's okay. Otherwise, I will go on give the explanation for each and every MCQs. Today, I have targeted 25 MCQs in this session. So stay connected. Let's solve the MCQs together. Okay, my dear aspirants. Okay. So yes, okay. So Glietti's space indicate which of the following space? Glietti's space. So you have to just mention that Glietti's space is indicating which of the following space, whether it is prevertebral space, paravertebral space, retropharyngeal space, or peritonsillar space. According to you, which is the best answer? So your time starts now. Please mark the correct answer. Let me just check your live messages. Okay, yeah, okay. So A, B, C, D, which is the right answer? Glietti's space indicate which of the following space? What is Glietti's space is considered as the name of which of the following space? So a direct MCQ only. Actually, the correct answer is retropharyngeal space. So Glietti's space is the other name of retropharyngeal space. And my dear aspirants, I would like to show you a diagram, schematic diagram showing the sagittal section of head and neck series, which will help you to differentiate between two important spaces which is often getting confused. One is the retropharyngeal space and the other is danger space of the neck. So yes, let me show you this diagram. So I am just slightly enlarging this diagram. So I think this will be better for you to understand. So when I am enlarging it, you can see two spaces has been shown in this diagram. One is designated with red color, that is called as danger space. So Ruchi has given the answer, and Ruchi has given the answer 3. Ruchi is absolutely correct. Ruchi, you are absolutely correct. Now see here. So my dear aspirants, I am using a danger space which is shown in red color, as you can see in this diagram. This is the danger space. Okay, so now it is important to know that danger space is exactly lying between which two space. So in this diagram, you can clearly appreciate the danger space is lying between, it is exactly located between the alar portion of deep cervical fascia and posteriorly prevertebral layer of deep cervical fascia. That means danger space is lying between alar fascia and prevertebral layer of DCF, means deep cervical fascia. So exactly this is the location of danger space. Now just anterior to danger space, there is another space which is called as the true retropharyngeal space, which is also called as Glietti's space. So let me use yellow color for this, because in this diagram also yellow color has been used. So this is the true retropharyngeal space lying anterior to that of Glietti's space or danger space, and it is exactly lying between. If I want to tell exactly the location of true retropharyngeal space, it is lying between buccopharyngeal fascia and that posteriorly the alar fascia. So this is, so that means by seeing this diagram, it is quite clear. By seeing this diagram, so let me again come to the actual diagram. So by seeing this diagram, it is quite clear that the true retropharyngeal space is lying anterior to danger space of the neck. So yes, let's move on to the second MCQ. Okay, mentalis does which of the following function? What is the action of mentalis muscle? Mentalis muscle is a small slip of muscle lying on the anterior aspect of the mandible near the midline. So it elevates the eyebrow skin of forehead, function as an sphincteric opening for an oral opening, elevates the lip, upper lip, and dilates the nostrils, elevates and protrudes lower lip, draw the ala of nose towards the nasal septum. So already the hint is provided with me. I have provided the hint because I have told you the location. Now you can mark the correct answer. Question number 2, your time starts now. Whether it is A, B, C, D, E, what is the correct answer? Mentalis. Mentalis does which of the following? Mentalis does which of the following? Okay. So, my dear aspirants, according to you, which is the correct answer? Please mark the correct answer. So, actually the correct answer is it elevates and protrudes the lower lip. Okay. So, let me show you the diagram which will help you to understand the mentalis muscle. By the location only you can know the correct answer. The location is lying in the close to the lower lip. Okay. So, see here this diagram. So, actually if we talk about the action of mentalis muscle, it is elevating and protruding the lower lip, and in this diagram the muscle which is highlighted. So, let us just focus on this. So, see here in this diagram the muscle which is highlighted here, as you can see here, this small slip of the muscle which is lying close to the lower lip. So, when it acts, so this slip of muscle is mentalis muscle, and this slip of muscle is mentalis muscle. So, when the mentalis muscle contracts, it will protrude the lower lip like this. Okay, like this. So, this is the action of mentalis muscle. Okay. So, is it clear? If you are knowing the location of mentalis muscle, you are knowing the action. Okay. So, done with this now. Okay. Now, let us move on to the question number 3rd. Question number 3rd. Which of the following best describes the pathway of tear from lacrimal gland reaching to the nasal cavity? Yes, hello everyone, those who have joined. So, there is 5 options and you have to give me the right answer. Option A, lacrimal duct. So, please read the option. So, I will just wait for 30 seconds. You read all the options, and this is the exact, you have to know the pathway of flow of tears, and whenever we cry, we weep, the tear flows from our eyes, and you will see that also the watering will be seen from the lower aspect of the nostril. So, it has ultimately to reach the nasolacrimal duct. So, that is important for you to know. So, please mark the correct answer. Your time starts now. Which is the best way to describe tear flow from lacrimal gland to the nasal cavity? 5 options are there. Mark the correct answer. Question number 3rd. So, actually if we talk about the correct flow, so that is A is the correct answer, lacrimal duct. So, like from lacrimal gland the tear will flow into the lacrimal duct, then it will move into the lacrimal lake, it will move on to the lacrimal canaliculi, ultimately reach the lacrimal sac, and thereafter it will flow into the nasolacrimal duct. So, I will give you the details of the flow of the tears, and I will also show you the diagram, don't worry about it. So, let us move with the explanation. Now, when we are talking about tears flowing from the lacrimal duct, the first thing is that we know that from lacrimal gland, the tear will reach the lacrimal ducts across the eye and will ultimately, so first is lacrimal duct. So, from the lacrimal gland, it will reach to the lacrimal duct, then will reach to the lacrimal lake, then it will pass through the lacrimal punctum, which was not given, onto the lacrimal papilla, will reach the lacrimal canaliculi, into the lacrimal sac, and ultimately will be reaching its ultimate position through which the tear is secreted from the nostril, that is the nasolacrimal duct. Nasolacrimal duct opening is lying in the inferior meatus of the nasal cavity. So, this is exactly the flow of tears which is mentioned here. Now, my dear aspirants, the lacrimal lake is there. So, the next important point is that you should know what is lacrimal lake. So, lacrimal lake is the pool of tears which is lying in the lower conjunctival cul-de-sac, which drains into the opening of tear drainage system, that is called as puncta. Lacrimal is puncta. The whole volume of lacrimal lake, which is formed by the pool of tears, is estimated to be 7 to 10 microliters. What is the total volume of the lacrimal lake? Quantity of the tear is approximately 7 to 10 microliters. 7 to 10 microliters. Okay. Now, see this diagram. Here you can see this is exactly what is designated and shown here. This is the lacrimal gland which you are seeing. This is the lacrimal gland. From the lacrimal gland, the tear has flown through the lacrimal duct, and thereafter it will reach through the canalically into the punctum, and then it will reach the lacrimal sac. You can see this sacculated structure, and then ultimately it will reach the nasolacrimal duct. Where is the nasolacrimal duct located? The nasolacrimal duct is located in the inferior meatus of the nasal cavity. So this is whole pathway of the drainage of lacrimal fluid. Okay. So is it clear? So we will choose. So exactly after the explanation, it is quite clear the lacrimal duct is the first. From the lacrimal gland, the lacrimal fluid will reach the lacrimal duct, then lacrimal lake, that is the collection of lacrimal fluid 7 to 10 microliters, then lacrimal canalically, lacrimal sac, and ultimately into the nasolacrimal duct. So we have got A as the correct answer. Okay, my dear aspirants, so let's move on to the next, that is question number 4. Which fascicle layer is not correctly matched with the structure it encloses? Which of the following fascicle layer match the following is not correct? Actually, in this diagram you can see various fascias of deep cervical fascia. We know that deep cervical fascia is having various modification, it is having various layers, it is having investing layer of deep cervical fascia, it is having pretracheal layer, it is having prevertebral layer, it is also having superficial cervical fascia, and it's one of the modification of the two layers of deep cervical fascia is carotid sheath. Anteriorly, carotid sheath is formed by pretracheal layer of deep cervical fascia, and posterior layer of carotid sheath is formed by prevertebral layer of deep cervical fascia. So my dear aspirants, you have to just mark the correct answer or the correct match the following. No, in this you have to mark all is correct except the one. So you have to search the incorrect match the following. Incorrect match the following. So I got an answer from Amitabh Behra. What about others? Amitabh Behra has given the answer. What about others? So he has given the answer 4, that is prevertebral layer of deep cervical fascia. Okay. So he has given 4. So we have to mark the incorrect one. Please take your time, Amitabh and everyone. We have to mark which of the following is not correctly matched. We have to not match the correct one. Not correctly match. The incorrect match the following. Incorrect. So actually superficial fascia enclosing platysma is absolutely correct. Actually we know that platysma is a muscle which is lying in superficial fascia, and it is an example of panniculus carnosus muscle. Panniculus carnosus muscle. Okay. Now investing layer of deep cervical fascia is enclosing two muscles, trapezius and sternocleidomastoid muscle is absolutely correct. Pretracheal layer of deep cervical fascia is enclosing suprahyoid muscle. Actually, this option is not correct. This is wrong. Why? Because it is not enclosing suprahyoid muscle, but it is enclosing which group of muscle? It is enclosing infrahyoid group of muscle. It is enclosing infrahyoid group of muscle, not the suprahyoid group. Prevertebral layer is enclosing the posterior muscles, longus colli, capitis, and deep cervical fascia. Carotid sheath. So yes, all of you correctly know that carotid sheath is an important content lying in the carotid triangle, and it is enclosing all the carotid arteries, external, internal carotid arteries, internal jugular vein and vagus nerve. So we have Amitabh Behra, you have absolutely given the right answer. So that means we have got C as the incorrect option, because we have to mark which is not correctly matched, which is not correctly matched. Now, pretracheal fascia of deep cervical fascia invested the infrahyoid muscle. My dear aspirants, this is one transverse section. So this is just a transverse section of the deep cervical fascia. So actually this is showing the 3 layers of deep cervical fascia. We know that deep cervical fascia is having investing layer, it is having investing layer, it is having pretracheal layer, and it is having prevertebral layer. So I will use 3 colors for these layers. So let's start with the investing layer. So the outermost layer is the investing layer. See here, this is the investing layer which is enclosing here 2 muscles. As you can see, this is sternocleidomastoid muscle. So if you want, I can just slightly enlarge. Is it okay? Yeah. So you can clearly see it is enclosing. Anteriorly, it is enclosing the sternocleidomastoid muscle, posteriorly the trapezius muscle. Yeah. So yes, it is the trapezius muscle is enclosed, and anteriorly sternocleidomastoid muscle it is enclosing, and this is the investing layer of deep cervical fascia. So we are talking about which layer? We are talking about investing layer of deep cervical fascia enclosing sternocleidomastoid muscle and that of trapezius muscle. Actually, investing layer of deep cervical fascia is forming the roof of two triangles. It is forming the roof of anterior triangle and posterior triangle, and it is enclosing two muscles, sternocleidomastoid muscle and trapezius muscle. Okay, now let's talk about the prevertebral layer. So when we are talking about prevertebral layer, let me use blue color. It is arising from the investing layer of deep cervical fascia, and then it is forming anterior layer of carotid sheath, and it is enclosing the thyroid gland. See here, it is enclosing the thyroid gland. So this is the pretracheal layer. This is the whole detail of pretracheal layer. Yes. Now, so if you will see one more, I will use green color for the prevertebral layer, which also arises from investing layer and forms the posterior layer of carotid sheath and will cover the posterior muscles as shown here. So this is the muscles which is enclosed by. So this is the prevertebral layer shown with green color. So this is the prevertebral layer. So we have done with the marking of the three layers. Now, my dear aspirants, one more point which was wrongly mentioned in the MCQ was about one more point. So yes, was about. So see here, this is exactly the carotid sheath which you are seeing, which is containing the carotid, arteries, and that of which is containing carotid arteries, internal jugular vein and vagus nerve. So you can see here also, if I use this color, you can see here this is the carotid artery. Then we have got the vein and we have got inside the nerve also. Okay, nerve also. So these three structures which is shown here is internal jugular vein, carotid arteries and that of vagus nerve. So this point was also correct. Now see the muscles which is related with, yes, I'll say hello dear. Now you can see the muscles which is related with the investing layer of deep cervical fascia in this diagram. So what you can see that in this, so here I will just show you. So see here, pretracheal layer of deep cervical fascia encloses infrahyoid muscle, and this was the wrong. Pretracheal layer of deep cervical fascia enclosing infrahyoid muscle. So you can see here these muscles were lying very close to that of pretracheal layer. So these small muscles on either side. Can you see here? So here also labeling of this muscle. So it is sternohyoid, it is sternothyroid, and it is omohyoid muscle, superior belly of omohyoid. So my dear aspirant, this sternohyoid muscle, sternothyroid muscle, omohyoid muscles are which group of muscles? This is which group of muscles? These are infrahyoid muscles. These are infrahyoid muscle lying below the hyoid bone, not suprahyoid muscle. One more muscle is lying in this group. What is that? That is thyrohyoid. So thyrohyoid, sternohyoid, sternothyroid and omohyoid muscles are the infrahyoid muscle. They are not suprahyoid muscle. Suprahyoid muscle is mylohyoid, geniohyoid. So these are suprahyoid muscle. So is it clear to everyone? Amit, Behra, Alice, everyone? Ruchi? Okay, so can we move on to the next MCQ, that is MCQ number 5th. So let's move on with the 5th number MCQ. Okay, nerve of pterygoid canal is composed of which of the following? Nerve of pterygoid canal is composed of lesser petrosal nerve and deep petrosal nerve, or greater petrosal nerve and deep petrosal nerve. So, so please read all the 5 options because I am providing you with okay, Amit Behra has already given the answer, very quick, very good. So what about others? So just read this all options and then mark the correct out. So then mark the correct answer. Okay. So I already got an answer from Amit Behra. Just let me give you the correct answer. So nerve of pterygoid canal. What is the other name of nerve of pterygoid canal? Can anybody tell me what is the other name of nerve of pterygoid canal? Nerve of pterygoid canal. It is also called as nerve of pterygoid canal is also called as, it is given a particular name. It is also called as, anyone? Yes, Weiden nerve. It is also called as Weiden nerve. Very good, Amit Behra. And Weiden nerve is formed by greater petrosal nerve joining deep petrosal nerve. Okay, so greater petrosal nerve is a branch of which nerve? My next MCQ is greater petrosal nerve is a branch of which nerve? Greater petrosal nerve is a branch of which nerve? Greater petrosal nerve is a branch of facial nerve. It is a branch of facial nerve, first branch of the facial nerve. And deep petrosal nerve. Deep petrosal nerve is formed as sympathetic plexus. It is formed by the sympathetic plexus covering internal carotid arteries. Okay, internal. So yes, absolutely correct, all of you. Greater petrosal nerve joining with deep petrosal nerve is called as nerve of pterygoid canal. Alam Ansari, absolutely correct. So yes, B is the correct answer. Greater petrosal nerve and deep petrosal nerve join together to form nerve of pterygoid canal. Absolutely correct, my dear aspirants. Yes, sympathetic plexus around internal carotid artery. So see here, greater petrosal nerve is the parasympathetic fibers of facial nerve joining with deep petrosal nerve, sympathetic plexus covering the internal carotid artery, and together they will form pterygoid canal, nerve of pterygoid canal. This was asked in the MCQ, nerve of pterygoid canal. So yes, my dear aspirants, let's move on to the next, that is question number 6. Question number 6. Woodruff area is located at antero-inferior part of nasal septum, posterior-inferior part of nasal septum, superior part of nasal septum, posterior-inferior part of lateral wall of the nose. Okay. So posterior-inferior part also, I got an answer from Amit Behra. What about others? Woodruff area is located on which of the following location? Question number 6. Anyone else wants to attempt? Anyone else? If it is right and wrong, that doesn't matter. You should attempt it. Okay, you should give it a try. You should give it a guess also, and then we will come up with the explanation. So my dear aspirants, the correct answer is, actually it is located in the lateral wall. So the correct answer will be posterior inferior part of lateral wall. It is not present in the medial wall. In the medial wall, it is not present in the medial wall. It is exactly located at the posterior inferior part of the lateral wall. So we will go with D as the correct answer. Let me show you a diagram and explain you the contents. My dear aspirants, firstly write the definition. When actually there is two area of epistaxis. Anteriorly we have got area of epistaxis which is called as casal back plexus, which is found in nasal septum. You are absolutely correct, Amit. When we Amitabh, when we are talking about casal back plexus, it is in the nasal septum. But when we are talking about Woodruff area on plexus, it is in the lateral wall of the nose. So Woodruff plexus is located below the posterior end of inferior turbinate of lateral wall of the nose. So we know that in the lateral wall of the nose we have got three turbinates: superior, middle and inferior turbinate. So just below the inferior turbinate or concave in the lateral wall of the nose, at the posterior end of it we have got nasopharyngeal plexus. Okay. Yes, Amit. So my dear aspirants, this is to make you understand. This is schematic diagram. To make you understand. Anatomically it is not correct. It is not correct anatomically. Okay. So let me show. Like for a casal back plexus, we know anterior epistaxis. It is in the nasal septum. Located in the nasal septum, and the posterior epistaxis is by Woodruff plexus, common origin, and it is present in the lateral wall posteriorly. Lateral wall, posterior part. So for posterior epistaxis, we have got Woodruff plexus. Okay, please everyone, don't get it anatomically correct, just to make you understand the location. What is the reason? So this MCQ, this is just making you understand that anterior epiplexus, anterior bleeding of nose is by casal plexus, and Woodruff plexus is common site for the posterior bleeding. It is very clear that posterior epistaxis region, Woodruff plexus, is located in the lateral wall, but casal back plexus is located in the nasal septum. Okay, so that concept will be clear. Now I would also like to give you the details of posterior bleeding and anterior bleeding. So anterior bleeding is more common kaun sa hai, which is the more common reason of bleeding. The more common bleeding reason is anterior bleeding, and the majority of this bleeding occurs in anterior septum. So this is in between the two nostril here, in between, this is the septum. Okay, this is the septum. So in the anterior part of nasal septum, the region of bleeding is located, and in the antero-inferior aspect of nasal septum, we have got the location of little's area. In that little's area, we have got causal back plexus. Now these causal back plexus, the important arteries which is forming the plexus is the septal branch of anterior ethmoidal artery. It is formed by septal branch of anterior ethmoidal artery, which is a branch of ophthalmic artery, lateral nasal branch of sphenopalatine artery, septal branch of superior labile artery. So all these arteries, also sometimes greater palatine artery. So basically these three important arteries is forming the causal back plexus located in the antero-inferior aspect of nasal septum. Now let's talk about the posterior bleeding, which is less common, but in 10% of cases we see the posterior bleeding also. In 10% cases, okay, we see the posterior bleeding also, that is located in Woodruff plexus. Actually Woodruff plexus is formed by confluences of the vessels posterior to middle turbinate. Posterior to middle turbinate located close to inferior turbinate also, both are correct. And actually the important site of its bleeding is by sphenopalatine ascending pharyngeal intermaxillary vein. Actually this is more of a venous plexus, sphenopalatine ascending pharyngeal and also internal maxillary vein, which is the location for the posterior bleeding, that is Woodruff plexus. Let's move on to the next, that is question number 7. All the best, my dear aspirants, all the best. So let's move on to question number 7. Arcuate eminences of petrous temporal bone is formed by. Arcuate eminences of petrous temporal bone is formed by which of the following? Options are superior semicircular canal, posterior semicircular canal, lateral semicircular canal, or cochlea. Okay, so Mulay, Vedan and Amit Behra has given the answer. Okay, so we are the most important MCQs related to head and neck region is quickly revised. So many of you must be knowing this also. So very good. The superior semicircular canal is absolutely correct answer. Again a direct MCQ. Actually superior semicircular canal part of the internal ear, and due to it there is a elevation found in the petrous part of temporal bone in the middle ear cavity, and that is labeled as arcuate eminences. So see this diagram. This is the showing you the interior of this is showing you the interior close to the petrous part of temporal bone. Here this is the petrous temporal bone, and this eminences, this elevation which you are seeing, this elevation which you are seeing is called as arcuate eminences, which is due to, which is formed due to superior semicircular canal. Okay, those who have made mistake, please revise it. Okay, my dear aspirants, let's move on to the next. Question number 8. Lamina pepperacia is lying between. What is the location of lamina pepperacia? It is located between optic nerve and orbit, or maxillary sinus or orbit, ethmoid sinus or orbit, cranial cavity or orbit. So my dear aspirants, question number 8, we have got 4 options A, B, C and D. Please mark the correct answer. Lamina pepperacia is located between which of the following structure? Okay, so your time starts now. Which is the correct one? Lamina pepperacia is located between. I got an answer from Amit Behra. What about others? So exactly, Amit, you have given the right answer. The location is between ethmoidal sinus and orbit. So absolutely correct. Okay, actually this is a very thin plate of the bone. So this is very thin plate of the bone, and it is often injured, and it should be known that exactly this thin plate of bone is residing between the medial border of the orbit and ethmoidal sinus. Okay, so let me show you the diagram and help you to understand lamina pepperacia. So firstly, let me just enlarge this CT scan image so that you can understand the location of lamina pepperacia, which has been asked in the MCQ. So firstly, let me outline the orbit. So this is the boundary of orbit. So this is the orbit Okay. Now, ethmoidal air sinus, let me just show you, these are all ethmoidal air sinuses. These are what? These are all ethmoidal air sinuses. Okay, these are ethmoidal air sinus. Here also we have got ethmoidal air sinuses. Okay, in between ethmoidal air sinus and that of orbit, the thin plate of bone which is residing, this is lamina papyracea. The thin plate of bone which is exactly lying between orbit and ethmoidal air sinus is called as lamina papyracea. Okay, so this is also written here, the proximity of ethmoidal air sinus to orbit, and these two important structures are separated with each other because of a presence of thin plate of bone called as lamina papyracea. So got it everyone? So we will go with C as the correct answer. Absolutely great, Mulai great, and also Amitabh Behra great. So let's move on to the next. Which of the following artery is not a branch of ophthalmic artery? The options are supraorbital artery, supratrochlear artery, the lacrimal, anterior ethmoidal, infraorbital. So 5 options are there, and you have to tell me which of the following artery is not a branch of ophthalmic artery. If you remember, I have shared a mnemonic also for remembering the branches of ophthalmic artery. Question number 9. Your time starts now, otherwise I will come up with the explanation. Which of the following artery is not a branch of ophthalmic artery? Okay. Got it? Amitabh has given the answer. Amitabh has come up with his answer. What about others? Okay, so yes, infraorbital. So yes, infraorbital is the correct answer. Can you tell me, infraorbital artery is absolutely correct. It is not a branch of ophthalmic artery. Can you tell me infraorbital artery is a branch of which artery? My next MCQ is, you can just give me the answer. So yes, you are absolutely correct. It is a branch of maxillary artery. Absolutely correct. Absolutely correct, Amitav. Can you tell me, it is a branch of maxillary artery which part? It is a branch of maxillary artery which part? To be more specific, it is a branch of third part of maxillary artery. Okay, we know that the key muscle, which is the key muscle of infratemporal region? Which is the key muscle of infratemporal region? Key muscle of infratemporal region. Lateral pterygoid muscle is the key muscle of infratemporal region because it is dividing maxillary artery into 3 parts. First part, second part, and third part. So yes, now here it is important that we should also know the branches of maxillary artery, and we should also know the branches of ophthalmic artery. And ophthalmic artery itself is a branch of which artery? Ophthalmic artery itself is a branch of ICA. What is ICA? Internal carotid artery. It's a branch of internal carotid artery. Got it? Yeah. So see here. Infraorbital artery is a branch of third part of maxillary artery. So this was the correct answer. It's a not branch. Yes, absolutely correct, Amitabh. It's not a branch of ophthalmic artery. Now, my dear aspirants, as I told you, lateral pterygoid muscle is the key muscle which is dividing the maxillary artery into 3 parts. So let me just enlarge this. This diagram is a single diagram explaining you the important branches of maxillary artery. So the first part branches are before lateral pterygoid. So just before the lateral pterygoid, within lateral pterygoid or lateral to it is the second part, and beyond lateral pterygoid, branches given in the pterygoid region, and that is pterygopalatine region, that is the third part of maxillary artery branches. So here lateral pterygoid muscle is a very important muscle. So see here you can see the demarcation of the muscle is this. This is the lateral pterygoid muscle. As we know, the second part is the lateral pterygoid muscle is either related inside it or lateral to it, or deep to it and superficial to it. So actually when we see the second part branches, very easy to remember, it is muscular, deep temporal, muscular branches, the buccal branches. Okay, so actually, so what pterygoid, temporal, pterygoid branches. So actually pterygoid branches, buccal branches, masseteric branches and deep temporal. All these are branches. So surrounding muscles are there. Masseteric branches, pterygoid branches, buccal branches, deep temporal. All these are muscular branches from the second part. If we talk about the first part, the branches are anterior tympanic, okay, deep auricular, accessory middle meningeal and middle meningeal artery, accessory middle meningeal artery and inferior alveolar. So see here, these are, this is first, second, third, fourth and 5. These are the 5 branches of the first part. These are the 5 branches of first part, and just remember that muscular branches are the branches from which part? Is the branches from the second part. Muscular branches are the branches from the second part. Okay. The branches from the third part are infraorbital, okay, sphenopalatine, the pharyngeal arteries, the greater lesser palatine, posterior superior alveolar. All these branches are the branches from the third part of maxillary artery, and clearly we can see, this was asked in the MCQ, and we can clearly appreciate that infraorbital artery is a branch from third part of maxillary artery. Now my dear aspirants, let's move on to the branches of ophthalmic artery. Next important is to know the branches of ophthalmic artery. Okay, so if we talk about the branches of ophthalmic artery, the branches of ophthalmic artery can be memorized by a mnemonic. The mnemonic is, what is the mnemonic? The mnemonic is Dr.Monalisa. The branches of ophthalmic artery can be memorized by the mnemonic Dr.Monalisa. Dr.Monalisa. Okay, so here D stands for dorsal nasal artery. Here D stands for dorsal nasal artery, R for central retinal artery, M for muscular, C for ciliary artery, both short and long ciliary, L for lacrimal, E for ethmoidal artery. Here also both anterior and posterior ethmoidal artery, supraorbital artery and supratrochlear arteries. I for internal palpebral arteries. So see here, just remember the mnemonic Dr.Monalisa, which is a mnemonic for the branches of ophthalmic artery. D for dorsal nasal, R for retinal, M for muscular, C for ciliary, L for lacrimal, E for ethmoidal, both anterior, posterior, S for supratrochlear, supraorbital, I for internal palpebral artery. Now my dear aspirants, the first and the second branches from the mnemonic are terminal branches, both of which, the first branch, this is dorsal nasal, and the second last branch, actually these are the terminal branches which is supplying. So the first and second, so the first is dorsal nasal, which is the terminal branch, and the supratrochlear is the terminal branch which is giving innervation to that of the passes medially. The dorsal nasal artery exit medially to supply, and also the other branches to nasal and that of forehead and the scalp. Okay, so this is the mnemonic. Is it okay? So these are the branches which is exiting the medially to supply forehead and scalp. So now let me show you this diagram which is showing you, if I enlarge it, you can clearly see that the source of ophthalmic artery is internal carotid artery. The source of ophthalmic artery is internal carotid artery. This is the ophthalmic artery branch of internal carotid artery. It's a cerebral branch of internal carotid artery, and its various branches which is shown here is dorsal nasal, palpebral, supraorbital, frontal and posterior, anterior, ethmoidal, muscular, lacrimal, central, retinal. All important branches has been shown here. So let's move on to the next, that is question number 10th. Okay. Which structure passes through the gap between middle and inferior constrictor muscle? Which of the following structure is passing or traversing through the gap between middle and inferior constrictor muscle? Whether it is superior laryngeal artery, stylopharyngeus muscle, vagus nerve, recurrent laryngeal nerve, inferior laryngeal artery. A, B, C, D, E. Question number 10th. Mark the correct answer. Which structures passes through the gap between middle and inferior constrictor muscle? Your time starts now. Mark the correct answer. So yes, I got A and D as the answers. A and D. Okay. Gap between middle and inferior constrictor. Okay, the correct answer is laryngeal, that is superior laryngeal artery is the correct answer. Superior laryngeal artery is the correct answer. For head and neck series, it is important that you should know the gap of all the constrictor muscles of the pharynx. So, let me show you a diagram for it and we can revise all the gaps and the structures passing. So, actually superior laryngeal vessels and internal laryngeal nerve, these are the two structures, okay. These are the two structures, that is superior laryngeal vessels and internal laryngeal nerve, which is passing between middle and inferior constrictor muscle. We know that there is a superior, middle, inferior constrictor muscle. Inferior constrictor muscle again is having two parts, thyropharynges and cricopharynges. These are the two parts of inferior constrictor muscle, and it is very important that we should know the structures traversing through this gap, in the individual gap. So, let us see this. Firstly, I would like to share this image where you can see this muscles, pharynx muscles, constrictor muscles, superior view. So, here muscles of the lateral, muscles can be seen from the lateral view, sorry, there you can see the muscles as seen from the lateral view. So, here you can see the gap. Okay. Okay. So, here you can see the gaps are superior to superior constrictor, gap between superior and that of middle constrictor. Then you can see gap between middle and inferior constrictor and a gap which is lying inferior to middle constrictor. Actually, the gap which is lying inferior to inferior constrictor is also called as tracheoesophageal groove. Got it? The gap which is lying inferior to inferior constrictor muscle is also called as tracheoesophageal groove and it is containing recurrent laryngeal nerve. So, we will come to that point. So, all the gaps of the constrictor muscle has been shown here. Now, let us see the structures passing through each individual gap. So, again I will show you a schematic diagram to make you understand the gap. So, this is a schematic diagram to make you understand the gap. So, let us firstly see the first space is lying, so first gap. So, let us see the superior constrictor muscle. Okay, so the first gap is lying superior to superior constrictor muscle. Okay, that means this is the gap. You have to, that means this is exactly the gap which is lying superior to superior constrictor muscle towards the base of the skull. This will be base of skull and this is called as space of Morgagni also, and the structures passing through it is, auditory tube. So, we can clearly see this is the auditory tube, pharyngotympanic tube. So, auditory tube is the structure, four structures passes. The other is one muscle, that is the muscle has also been seen, that is the levator villi palatini muscle. We have got the artery, that is ascending palatine artery. So, we have got ascending palatine artery. So, this is the artery. So, these are the three structures has been shown here, but four structures are there. One more structure I will tell you: auditory tube, levator villi palatini, ascending palatine artery, and the fourth structure which also I want to write, one more structure is there not shown in this diagram, that is palatine branch of, ascending pharyngeal artery, APA. What is APA? Ascending pharyngeal artery. Ascending pharyngeal artery. So, got it everyone? How many structures are passing superior? So, please revise it. The structures passing superior to superior constrictor muscle is 4. So, here we are seeing the superior constrictor muscle. This muscle which you are seeing here in the line diagram, this is the superior constrictor muscle. The space which is lying superior to it, 4 structures passes through it. 4 structure passes through it, as you can see here, 4 structures passes through it. Auditory tube, levator villi palatini, ascending palatine artery, and the palatine branch of APA, that is ascending pharyngeal artery. Okay, now let us see the gap between the superior constrictor and that of middle constrictor muscle. So, this muscle is the middle constrictor muscle. So, the gap between superior constrictor muscle and the middle constrictor muscle. So, the structures passing will be, there is one muscle, that is stylopharyngeus muscle. So, stylopharyngeus muscle and that of inferior constrictor muscle. So, this is the gap between middle constrictor and that of inferior constrictor muscle. The structures traversing is internal laryngeal nerve and superior laryngeal vessel. The structures traversing is internal laryngeal nerve and that of superior laryngeal vessel. Got it? Internal laryngeal nerve and superior laryngeal vessels. Now the gap which is lying below, inferior constrictor muscle. So now we will talk about the gap which is lying below, inferior constrictor muscle. Two structures are passing below inferior constrictor muscle. The two structures are inferior laryngeal vessels and that of recurrent laryngeal nerve. See here, inferior laryngeal vessels and that of recurrent laryngeal nerve. So got it everyone? Let me just shorten it and here. So I think once more you can see the entire diagram and you can see all the structures passing between the gap of the constrictor muscle. So in short, with this diagram we are understanding all the structures passing through various gap as seen in the gap of constrictor muscles. So done with this now. So now my dear aspirants, let's move on to 11th number MCQ. Okay. Let's move on to 11th number MCQ. Which nerve might be damaged by fracture involving cavernous sinus? Which nerve might be damaged by fracture involving cavernous sinus? Whether it is olfactory tract, optic, abducent, facial or vestibulocochlear. Question number 11th. Which nerve might be damaged by fracture involving cavernous sinus? A, B, C, D, E. 5 options are there. So Sai has given his answer. What about others? Let me just check. So that we can mark the correct answer. So which nerve might be damaged by fracture involving cavernous sinus? So here we have got following options. Okay, mark the correct answer. Sai, please mark the correct answer. Oh, Sai has given his answer. What about others? So Sai, you are absolutely right. The correct answer is abducent nerve. Abducent nerves. Question number 11. The correct answer is abducent nerve. Okay. Okay. So Amitabh Behra is also right. The correct answer is abducent nerve. Abducent nerve is the correct answer. So I would like to show you the cavernous sinus diagram which will help you to understand the nerves being involved. Actually, more commonly, if there is fracture involving cavernous sinus, it will lead to the damage of oculomotor nerve or abducent nerve. It can lead to the damage of third cranial nerve or that of sixth cranial nerve. Actually, the lateral wall we have got also the oculomotor nerve, ophthalmic division and sometimes the maxillary division also is related, but most commonly the oculomotor nerve and abducent nerve is involved. So let's see here. So if I show you this diagram, I enlarge it and let me show you the important nerves being related. So the nerves here being related, as you can see here, from top to bottom we have got oculomotor, we have got trochlear, we have got the ophthalmic nerve and we have got lower down maxillary nerve also. So here these 4 nerves has been shown to you: oculomotor, trochlear, ophthalmic, maxillary and inside. Okay, the nerve which is traversing inside, this nerve which is passing through and through, this is the abducent nerve. So basically most commonly abducent nerve is involved. So most commonly abducent nerve and that of oculomotor nerve along with the 4th or trochlear nerve is involved. Other than that, you can also see here that internal carotid artery is traversing and passing inside. So internal carotid artery is traversing and passing inside the cavernous sinus. So here if we have to mark the most common nerve to be injured in this case, then we will go with abducent nerve as the correct answer. Okay, so let's move on to the next, that is question number 12. Which nerve is not correctly matched with its distribution? Which of the following nerve is not correctly? What kind of fracture? Okay, which one? Okay, which nerve might be fractured involving? Okay, fracture of base of skull. So yes, fracture of base of skull. Dr. Tushar, fracture of base of skull. So actually sometimes the basal part of the fracture of the skull is involved. It is seen. Fracture of Dr. Tushar, Carla, fracture of base of skull. So yes, now let's move on to question number 12. Which nerve is not correctly matched with its distribution? Lingual nerve, sensation from anterior 2/3 of the tongue. Lingual nerve, which is carrying sensation from anterior 2/3 of the tongue. Lingual nerve, sensation from the floor of mouth and lingual gingivae. Coda tympanic nerve carrying taste sensation from anterior 2/3 of tongue. Coda tympanic nerve carrying secretomotor fibers to submandibular gland and sublingual gland, or coda tympanic nerve giving motor innervation to that of tensor tympani. So, which is not the correct match the following? In 5 options are there and you have to choose the incorrect match the following. Question number 12. So, I already got an answer from Amit Behra, waiting for others to reply. So, today we have got 25 MCQs, 25 MCQs. We will quickly solve it. Which nerve is not correctly matched with its distribution? Your time starts now. Please mark the correct answer. Question number 12. So, Amit, you have given absolutely correct answer, tensor tympani muscle. So, when we are talking about tensor tympani muscle, can you tell me what is the nerve supply of tensor tympani muscle? What is the nerve supply of tensor tympani muscle? It is the wrong match the following. This is the wrong match the following. So, we have got E as the correct answer. What is the nerve supply of tensor tympani muscle? Rest all option is absolutely correct. Yes, lingual nerve is carrying general sensation of anterior 2/3 of tongue. Lingual nerve is also supplying the lingual gingivae, taste fibers of anterior 2/3 coda tympanic nerve, and there is also involvement of coda tympanic nerve for the innervation or parasympathetic innervation of SMG, submandibular and sublingual gland. Mandibular nerve, Amit Behra, absolutely right. Yes, it is. So, see here, tensor tympani nerve is getting innervation from mandibular division of trigeminal nerve. Mandibular division of trigeminal nerve. Absolutely correct, dear, absolutely correct. Now, I would also like to show you a diagram for explaining or revising the innervation of the tongue muscle and that of sensory and that of general innervations of the tongue. So, see this diagram. This single diagram is showing you all important points about the innervations. So, let us focus firstly on the muscle. So, when I am talking about the muscles of the tongue, so when we are talking about the muscles of the tongue, all the intrinsic muscles of the tongue is getting innervation from hypoglossal nerve. All the other muscles of the tongue, means all the muscles of the tongue. Which all muscles? All the muscles of the tongue, genioglossus, chondroglossus, styloglossus, except palatoglossus, okay, hyoglossus, all except palatoglossus. Palatoglossus is only one muscle which is not supplied by 12th cranial nerve. Palatoglossus is getting innervation from 10th cranial nerve via pharyngeal plexus. All other muscles is getting innervation from 12th cranial nerve, hypoglossal nerve. This is the motor supply. Now, if I talk about its general innervation, sensory nerve supplying and giving innervation. So, if we talk about that, sensory nerve. So, let us talk about the sensory nerve. We have already done with the motor supply. So, here what you can appreciate here, that lingual nerve is required. Lingual nerve is giving general, is responsible for general sensation of anterior part of the tongue, but coda tympanic nerve is important for special taste sensation for the anterior part of the tongue. Okay. My dear aspirants, please note down that glossopharyngeal nerve, when we are talking about glossopharyngeal nerve, it is giving innervation to the posterior part of the tongue. Please note down one more point which is important to be noted in this diagram. So, actually when we divide the tongue into anterior and posterior part, the landmark of division is by sulcus terminalis. What is the landmark of division? The landmark of division is by sulcus terminalis. So, this is sulcus terminalis. My dear aspirants, here the sulcus terminalis, anterior to it becomes the anterior part. This is anterior 2/3 and this is the posterior 2/3. So, posterior 1/3. My dear aspirants, what here you can appreciate in this diagram, this is circumvallate papillae which is lying in the anterior part. It is lying in the anterior part, but it is also circumvallate papillae is also getting innervation from 9th cranial nerve. Please note down, circumvallate papillae is also located in the anterior part of the tongue, but it is also getting innervation from 9th cranial nerve, and the posterior most part of the tongue is getting innervation from internal laryngeal nerve. The posterior most part of the tongue is getting innervation from vagus nerve, that is internal laryngeal nerve, along with epiglottis, along with which structure, along with this epiglottis. So, both epiglottis and posterior most part of the tongue is getting innervation from vagus nerve. Clear everyone? So let's move on to the next. So we have done with this. Let's move on to the next MCQ, that is MCQ number 13. Question number 13. Please mark the correct answer. So let's move on to the next, that is question number 13. Which is correctly describing the wall of tympanic cavity, that means middle ear cavity. So which of the following is correct for the explanation of boundaries of middle ear cavity? Boundaries of middle ear cavity. Okay, boundaries of middle ear cavity. So here you can see here the match the following is there. Tegmental roof. Roof is formed by cochlea, contain promontory, floor by superior bulb of internal jugular vein, medial wall by middle cranial fossa, dura, anteriorly mastoid ear cells, facial nerve, posteriorly by carotid canal. So actually which is the correct about its match the following? Your time starts now. Please mark the correct answer. Question number 13. Which is the correct match the following? Mulai is telling C, medial wall by middle cranial fossa. What about others? So yes, your time starts now. Mark the correct answer. Amit is telling B. Okay, Amit. So yes, B is absolutely correct. Floor is formed by relation of internal jugular vein. Superior bulb of internal jugular vein is absolutely correct. It is lying in the floor. So we have got B as the correct match the following. All other options are perfectly wrong. Let me show you this a diagram and explain you the anterior, posterior, medial, lateral wall. So see here. My dear aspirants, the important point is that dura mater of the floor of middle cranial fossa is lying. So when we are talking about middle cranial fossa, it is forming roof of tympanic cavity. It is forming roof of tympanic cavity. Internal jugular vein, this was the correct for the MCQ, is related into the floor. It is related into the floor of middle ear cavity. When we are talking about lateral membranous wall, it is related with epitympanic recesses and contains head of malleus. Now, my dear, if we talk about the medial labyrinthine wall, actually tympanic cavity, middle ear cavity is medially separated or medially related to which part? Medially it is related to internal ear. Internal ear. When we are talking about anterior carotid canal is separated from the carotid canal, that means anteriorly it is related with the carotid canal. Posteriorly it is having the relation of facial nerve and mastoid ear cells. Posteriorly the middle ear cavity is related with mastoid ear cells and facial nerve. The same thing I would like to give you a diagram of middle ear cavity which will help you to understand. So here only one point was correct in this MCQ, that is floor is having the relation of jugular, superior bulb of jugular, superior bulb of internal jugular vein. So let's move on to that. So let's just slightly I will enlarge this diagram. Okay, is it clear? Yeah. So here first thing is that, okay, this part is the roof, this is the roof. So you can understand the middle ear cavity or tympanic middle ear cavity by taking a schematic diagram to just make you understand. So this is, my dear, roof, and you can see here the roof is having tegment tympani. It is related with the middle ear cavity. It is related with the middle cranial fossa. Tegmentum roof is formed by tegmentum roofs which is separating it from middle ear fossa. Now floor, when I am talking about floor, so see here this is the floor, and in the floor we have got internal jugular vein related, superior bulb of internal jugular vein related. So see here this is internal jugular vein which is shown with the blue color. This one, this is the internal jugular vein, so it is related with the floor. Got it? Now anterior wall and posterior wall. So when I use, so this is the anterior wall, this is the anterior wall, and in the anterior wall we have got following important structures which is shown in this diagram. So let me just show you. This is the anterior wall. So see here, this is the anterior wall and it is related with following structures. It is related with tegment tympani, auditory tube, it is related with carotid artery which is covered by sympathetic plexus, and it is also related with coda tympanic nerve. Okay, so see here the structures related in the anterior wall is tensor tympani small muscle, pharyngo-auditory tube or pharyngotympanic tube. It is having sympathetic plexus around internal carotid artery. So, carotid canal will be in anterior relation along with the coda tympanic nerve. Got it? Now, let us move on to the posterior wall. Posterior wall. So, this is the posterior wall which I am just showing you with this. Okay, this is the posterior wall. Important structures related in the posterior wall are additus to the mastoid antrum and facial canal. So, this part which you are seeing is the facial canal, and also there is a pyramidal eminences for the small muscles, stapedius muscles will be there, and actually coda tympanic nerve is traversing from here to, so it is exactly not having, so it is traversing throughout the middle ear cavity. It is traversing throughout the middle ear cavity. This is the pyramidal eminences, the additus are antrum, and the and you can see the vertical part of the facial canal. This is the facial canal part which is related to in the posterior wall. Now, medial wall. Now, let us talk about the medial wall. Okay, let us talk about the medial wall. So, this is the medial wall. The important structure or separation of medial wall of the middle ear cavity is from which area? Medial wall is separated from inner ear. So, it will have the prominences of semicircular canal, prominences of the oblique part. So, here there will be the oblique part of facial canal, prominences of semicircular canal. Two windows will be there. Okay, there will be oval window and round window. R for round window, and this is oval window, and there will be a promontory which is formed, and over the promontory there will be the branches of tympanic branches of glossopharyngeal nerve. Okay, so this promontory is formed by tympanic branch of glossopharyngeal nerve. So, all these walls has been shown. Which wall is not shown here? Lateral wall. So, lateral wall is formed by which structure? Which has been removed to see the interior of middle ear cavity. So, we can clearly see the middle ear cavity to understand its wall and important structures located. So, one of the wall is not shown, that is the lateral wall which has been removed. Tympanic membrane or eardrum has been removed so that you can see the interior of middle ear cavity. So, done. Let us move on to the next, that is question number 14. Which muscle is not contained in the posterior? Which muscle is not contained? Which of the following muscle is not forming a content for the posterior triangle? All of you can mark your answer. Which of the following structure is not forming a content for posterior triangle? Whether it is splenius capitis, levator scapulae, middle scalene muscle, posterior scalene muscle, or stylohyoid. Question number 14. Please mark the correct answer. Your time starts now. Which muscle is not contained in posterior triangle? Splenius capitis, levator scapulae, middle scalene, posterior scalene, or stylohyoid. Your time starts now. Mark the correct answer. I got an answer from Yashdeep A, Amit Behra E. Okay, question number 14. Actually, stylohyoid is absolutely correct answer. A stylohyoid, the small muscle which is extending from the styloid process of temporal bone to that of hyoid bone. So, this is actually the muscle of second pharyngeal arch which is getting innervation from pharyngeal arch, which is getting innervation from 7th cranial nerve, and this is not related or forming any important structures of posterior triangle floor. All other muscles are seen forming the floor of posterior triangle. These all muscles are forming floor of posterior triangle. So, we will go with E as the correct answer. Absolutely correct, Sai Amit Behra. So, see this. Posterior, if we talk about the posterior triangle of the neck, important structures lying in the floor is semispinalis capitis, levator scapulae, middle scalene, posterior scalene. Other than that, splenius capitis के साथ superiorly we will have semi-splenius capitis. We can also have semi-splenius capitis, vertical fibers in the superior most part we can see. In the superior most part of the posterior triangle floor, we can also see semi-spinalis capitis. Then we have got splenius capitis, levator scapulae, middle scalene, posterior scalene, also sometimes part of anterior scalene, and also the first digitations of anterior muscle can be seen, but these are the major muscles which is seen. Now I will also show you this diagram where you can see the vertical fibers of semi-spinalis capitis, which I have written also, semi-spinalis capitis, and lower to it we have got splenius capitis, levator scapulae, scalenus medius, which has been shown. So clearly you can see stylohyoid muscle is not forming the floor muscle or posterior triangle of the neck. So this all muscles are forming the posterior floor, or muscles forming the floor or posterior triangle, but not the stylohyoid. So we have moved with stylohyoid as the correct answer. So correct everyone. And posterior triangle we know that is divided by inferior belly of omohyoid into two triangles. Okay, occipital triangle and subclavian triangle. Inferior belly of omohyoid divided into two triangles. Superiorly we have occipital triangle and inferiorly we have got subclavian triangles because it contains subclavian vessels. Let's move on to the next, that is question number 15. Which is not a content of parotid gland? Which of the following structure is not a content of parotid gland? Facial nerve, facial artery, retromandibular vein, parotid lymph node, branches of facial nerve. Which of the following structure is not a content within parotid gland? Question number 15. 30 seconds for you, and please mark the correct answer. Amitabh Behra has given the answer. What about others? Okay, Amitabh Behra has given the answer. Facial artery. What about others? Facial artery. So absolutely correct, Amitabh, you are absolutely correct. Facial artery is not a content which is lying inside the parotid gland. Absolutely correct. So my dear aspirants, let's move with this. All other structures, both facial nerve trunk is traversing through the posterior aspect of parotid gland posteromedially, and then its 5 terminal branches, that is temporal, zygomatic, upper lower buccal, marginal mandibular, and the cervical branches traversing and is coming out through the anterior border of parotid gland. Also we have got retromandibular vein formed inside parotid gland. We have got the lymph nodes, parotid lymph node is lying inside. But we have not got the facial artery lying inside the parotid gland. Facial artery is basically related onto the mandible. It crosses the lower border of mandible over the body of mandible. So we have got B as the correct answer. Okay. Within parotid gland, facial nerve is found along with its branches. Other than that, we have got the retromandibular vein, external carotid artery, and parotid lymph node. These are the structures which is lying inside parotid gland, not the facial artery exactly. Okay. Now, I would also like to show you this diagram which will help you to understand the structures lying inside parotid gland. So, here we have clearly seen the outline of the parotid gland. This is the outline of the parotid gland which has been shown in this diagram. Okay. Now, the structures traversing inside. So, very nicely you can see the structure which is traversing inside is the facial nerve along with its 5 terminal branches, Okay. So, temporal, zygomatic, buccal, marginal and cervical. These 5 branches are also along with the trunks. That means the trunk of facial nerve is traversing inside, and also its 5 terminal branches are traversing inside the parotid gland. Other than that, we have got retromandibular vein. So, the trunk of retromandibular vein is lying inside. So, this is the retromandibular vein which is lying inside. So, yes, retromandibular vein is also residing inside the parotid gland. Also, we have got the external carotid artery. Okay. So yes, external carotid artery is lying there and its branches are emerging out from its border, okay, superiorly. That is, superiorly you can see two terminal branches also, superficial temporal artery and the branches, and we have got on the more, we have got also a duct which is emerging on the anterior border, that is the parotid duct, from the anterior border of parotid gland. So clearly you can see facial artery is not lying inside parotid gland. Got it? Let's move on to the next question, number 16. Superior orbital fissure transmit all of the following except. Superior orbital fissure transmit all except. Options are ophthalmic division of 5th cranial nerve, maxillary division of 5th cranial nerve, 3rd cranial nerve, 4th cranial nerve, or 6th cranial nerve. Question number 16. Superior orbital fissure transmit all of the following except. So that means the MCQ is targeting all the structures passing through superior orbital fissure. We have got 5 options, mark the correct answer. Question number 16. Okay, Amit Behra has given the answer. Maxillary division of trigeminal nerve. So maxillary division of trigeminal nerve, if it is the correct answer, can you tell me maxillary division of trigeminal nerve is traversing through which foramen inside the cranial cavity? So can you tell me maxillary division of trigeminal nerve is traversing through which foramen in the cranial cavity? Maxillary division of trigeminal nerve is passing through foramen rotundum. Actually, the structures passing through foramen rotundum can be memorized by mnemonic ME. M for the maxillary division of trigeminal nerve and E for the emissary vein. E for emissary vein. All other structures are passing through the superior orbital fissure, that is the 3rd, 4th, 6th nerve and ophthalmic division of the trigeminal nerve. So my dear aspirants, I would like to show you a diagram for it so that you can understand. So let me show you. Superior orbital fissure transmit ophthalmic vein, ophthalmic division of trigeminal nerve, trochlear, abduction and sympathetic fiber. So this is just a layout of the structures passing. This is just a layout of the structures traversing through superior orbital fissure. Actually, superior orbital fissure is divided into 3 parts and the structures are traversing through individual part. I will show you. Before that, I would like to show you the location of superior orbital fissure. Okay, so see here, let me slightly enlarge this diagram. When I enlarge this diagram, you can clearly see, okay. So when I am enlarging this diagram, you can see in the orbit. So this is what? This is the base of the orbit. This is outline of the, okay, this is the outline of the base of the orbit, and on this structure which you are seeing, will be near the apex of the orbit. This will be close to the apex of the orbit. So near the apex of the orbit, we have got 2 important foramen. One is the optic foramen and close to it is a retort shaped superior orbital fissure. So superior orbital fissure and optic foramen is towards the apical part or the apex of the orbit. As you can see here, we have got 2 fissures which is clearly seen. One is superior orbital fissure, retort shape, and the other is optic canal. The structures passing through optic canal is optic nerve and that of ophthalmic artery, optic nerve and that of ophthalmic artery, and through superior orbital fissures many structures passes. 3rd cranial nerve, the 4th cranial nerve, the 6th cranial nerve, nasociliary nerve, branches of ophthalmic division of trigeminal nerve, superior ophthalmic vein. So let me show you a diagram for it. So actually we can, this is again a schematic diagram to make you understand the structures traversing through the orbital apex, that is the structures traversing. So we know that orbital apex ke close we have got superior orbital fissure, and the structures traversing has been shown here. So superior orbital fissure, the structures traversing are. So if you will see, this entire structure is the superior orbital fissure, and what I told you, superior orbital fissure is divided into 3 compartments. Okay, this is the one compartment, this is the other compartment, this is the first compartment, this is the second compartment, this is the third compartment. The second compartment is lying inside the tendinous origin of annulus of Gin. What is annulus of Gin? Annulus of Gin is a tendinous, it is the origin of, from annulus of Gin all the recti muscle. So from annulus of Gin all the recti muscle originates. This is giving origin to all the recti muscles of extraocular muscles, that is extraocular muscles, all recti extraocular muscles, superior rectus, inferior rectus, medial and lateral rectus. So yes, here we can see the two structures traversing through optic canal, which is shown here, optic canal, that is optic nerve and ophthalmic artery. Clearly seen. Structures passing through the superior or lateral part of the superior orbital fissure, LFT. The mnemonic is LFT. So here L for lacrimal, F for frontal, T for trochlear. Other than that, we have got one more vein which is passing, and this vein is superior ophthalmic vein. So we have got superior ophthalmic vein which is also passing through the lateral or superior part of superior orbital fissure. Now let's talk about the structures which is lying inside. This tendinous ring. So this is the middle or intermediate compartment, and we have got the third and fourth cranial nerve, abducens nerve. So that is we have got abducens nerve, we have got superior and inferior division of oculomotor nerve and nasociliary nerve. Okay. We have already run the trochlear from the superior part or lateral part. Through inside this, we have got just the small four nerves. Actually, both the divisions of, so here we have got both the divisions, superior, inferior division of oculomotor, nasociliary and abducens nerve. Now, if we talk about the inferior aspect, we have got the inferior ophthalmic vein, and this is showing inferior orbital fissure, and the structures passing through inferior orbital fissure is also shown in this diagram. The structures are the branches, pterygopalatine ganglionic branches of maxillary nerve, infraorbital nerves and infraorbital vessels and zygomatic nerve. So actually this single diagram is showing you the structures traversing through superior orbital fissure and also the structures traversing through inferior orbital fissure. So done with this, can we move on to the next MCQ, that is MCQ number. So we have done with the MCQ number 16. Let's move on to the next, that is MCQ number 17. Okay. So which is a separate bone? Which of the following is the separate bone? Which is a separate bone? Superior nasal concha, middle nasal concave, inferior nasal concave, crista galli or glabella. So yes, your time starts now. Mark the correct answer. So yes, Sai, Prashnath, Amita, Behra, both of you are giving me the answer inferior nasal concha. Absolutely correct. Actually, it's the inferior nasal concha which is exactly the separate bone. Other than that, these are all the parts of which bone? Ethmoid bone. All other points and the bones which has been written is the parts from the ethmoid bone, but inferior nasal concha or terminate is a separate bone. So I will show you a diagram for it and it will be cleared. Inferior nasal concave is a separate bone, whereas superior, middle, inferior nasal concaves are all the extensions of ethmoid bone. These are the extensions of ethmoid bone seen in the lateral wall of the nasal cavity. Now, let me show you a diagram for it so that it will be clear. So firstly, I would like to show you the outline of the lateral wall of the nasal cavity. So here you can clearly see this is the lateral wall of nasal cavity, and in the lateral wall of nasal cavity, as we know this, if I highlight it, we clearly know that this bony prominences is ST, superior turbinate, this is middle turbinate. So superior and middle turbinate is the part of the ethmoidal bone itself, extensions from the ethmoidal bone itself, and lower to it you can see there is a separate bone. Actually this part is again inferior turbinate or the inferior nasal concha, and this is actually regarded as a separate bone. This is separate bone. This is a separate bone. Is it clear? Now my dear aspirants, let me just show you the parts of ethmoid bone. So I would like to show you the important parts of ethmoid bone. So ethmoid bone superiorly is forming crista galli. It is forming cribriform plate in the anterior cranial fossa. It is forming superior nasal concha. It is forming medial nasal concha. This is the perpendicular plate of the ethmoid bone. This is the inferior aspect. This is the superior aspect. Other than that, inside it is also an example of pneumatic bone. It is containing ethmoidal air cells, and this ethmoidal air cells are related to the medial wall of the orbit. So all these structures are the parts of ethmoid bone, and clearly we can see here. So exactly, if you will see this diagram, if I enlarge this, see here, this is the whole outline which is showing you the parts of the ethmoid bone. It is having, these are all parts for the ethmoid bone. So clearly inferior turbinate is not the part of ethmoid bone. So let's move on to the next MCQ, that is MCQ number 18. What is the action of inferior oblique muscle? What is the action of inferior oblique muscle? Actually, extraocular muscle action is very important for you to know, and firstly let me know what is the action of inferior oblique muscle, then I will come up with the explanation. Whether it is adduction, depression, extorsion, intorsion, what is the correct one? Question number 18. So Amitabh Behra has given the answer. Okay, I will not tell whether it is right or wrong. He has given his answer as adduction. What about others? What about others? Yes. Okay. Now Amitabh is absolutely right. Yes, now Amitabh is absolutely right. Action of inferior oblique is extorsion. Action of inferior oblique is extorsion. Actually, the action of oblique muscle is just opposite to their name. Action of oblique muscle is just opposite to their name. So, if I talk about superior oblique, so let me just write. So, action of superior oblique and the action of inferior oblique I will write. Actually, when we are talking about oblique muscles, their action are absolutely opposite to each, to their name. So it is superior. If it is superior, it will cause depression. It will cause just opposite action. It will cause depression of eyeball. It will cause intorsion, internal rotation of eyeball, and it will be active in abducted eye, so abduction. When I have secondary action, abduction. Inferior oblique, opposite to its name, so it will cause elevation, it will cause extorsion, and it is also active in abducted eye, abduction. So question number 18, C is the correct answer. Action of inferior oblique, C is the correct answer. Now my dear aspirants, see here, in case of extraocular muscles, we have got 7 muscles. We have got 4 recti, 2 oblique and 1 levator palpable superioris. So this diagram is correctly showing you all the muscles. We have got 4 recti muscles, superior rectors, middle rectors, lateral rectors and inferior rectors. We have got 2 oblique muscles, superior, inferior oblique. We have got 1 levator palpable superioris. It is important that you should know the action and nerve supply of each of this muscle. So see here. LPS, that is levator palpable superioris. What is the action? It is causing elevation of upper eyelid. Now, medial rectus, lateral rectus, most simple action. What it causes? Medial rectus will cause adduction of eyeball. Lateral rectus will cause abduction, lateral movement of the eyeball. Okay. Superior rectors, inferior rectors, superior rectors and the inferior rectors. Superior rectors will cause elevation of the eyeball, will be active in adduction of eye and will cause intorsion. The inferior rectors will cause depression of eyeball according to its name, will be active in the adducted eye, secondary action and extorsion. superior oblique and inferior oblique. So with this we will be completing all the 7 muscles. Okay, I didn't write the okay, yes, okay. Superior oblique is causing depression of the eyeball, active in abducted eye and causes intorsion. Inferior oblique will cause elevation, active abducted secondary movement and will cause extorsion, just opposite to its name. So is it clear? In short, we have done with all the action of all the 7 extraocular muscles. We have done with the action of 7 extraocular muscles. So yes, let's move on to the next, that is question number 19. Done with this? Okay. Now, which of the following does not give sensory supply to the pinna? Which of the following nerves which is mentioned here? So the nerves are auriculotemporal nerve, great auricular nerve, lesser occipital nerve, tympanic branch of glossopharyngeal nerve. 4 are there. So you have to just tell me which of the following nerve is not giving innervation to or innervation or sensory supply to the pinna. Question number 19. Okay, Amitabh is telling tympanic branch of glossopharyngeal nerve. Okay, okay. So all other nerves, so actually yes, auriculotemporal nerve, great auricular nerve, lesser occipital, all these 3 are important for the innervation. These all 3 nerves are innervating the pinna basically. But tympanic branch of glossopharyngeal nerve is not innervating the pinna. Basically it is innervating middle ear cavity. Okay, it is innervating middle ear cavity. So I would like to write the area of innervation of tympanic branch of the glossopharyngeal nerve. So tympanic branch of glossopharyngeal nerve, it is innervating, please write down, it is, if we talk about tympanic branch of 9th cranial nerve, it is innervating middle ear cavity. It is also giving innervation to auditory tube. It is also giving innervation to parotid gland and mastoid air cells. Okay, so done. So my dear aspirants, please see here the greater part. If we talk about the greater part of the pinna, it is getting innervation from auriculotemporal nerve, lesser occipital nerve. So when we are talking about auriculotemporal nerve and lesser occipital nerve, they are basically giving innervation to which area of the pinna? Area lying superior to concave. The lower part or the great auricular nerve is giving innervation to infrolaterally part of the lobule. So let me show a diagram for it. Okay, so these 3 nerves are giving major innervation to the major part of the pinna: lesser occipital, great auricular nerve, auriculotemporal. So here you can see this is the pinna, and here you can clearly see the nerves giving innervation are auriculotemporal nerve, greater auricular nerve and that of lesser occipital nerve. So lesser occipital nerve and auriculotemporal nerve are giving innervation superiorly. As you can see here, great auricular nerve is more passing through inferiorly. So this diagram is showing you the innervation. Okay, so done with it? Yes, my dear aspirants, let's move on to the next MCQ. In dislocation of jaw, displacement of articular disc beyond the articular tubercle of temporomandibular joint results from excessive spasm of which of the following muscle? Whether the reason is excessive spasm of lateral pterygoid muscle, medial pterygoid muscle, buccinator muscle or temporalis muscle. Okay, so question number 28, we have got 4 options and you have to give me the right answer. Okay, your time starts now. Question number 20th. Okay, D. Temporalis. displacement of articular disc. So please mind it, displacement of articular disc beyond articular tubercle of TM joint. That is the key point which is given to you. Okay, this is the key point which will help you to mark the correct answer. Means the muscle which has to be the correct answer should be related to articular disc of TM joint. Okay, so excessive spasm of which muscle? So you can now tell me the correct answer. I have given you the hint also. So actually this is talking about lateral pterygoid muscle. So for solving this MCQ rightly, you have to know the details of lateral pterygoid muscle. Lateral pterygoid muscle is the muscle of mastication. So muscles of mastications are lateral pterygoid, medial pterygoid, we have got temporalis and masseter muscle. Actually the insertion of lateral pterygoid muscle is occurring into the articular disc of TM joint and also into the fibrous capsule of TM joint and also into the pterygoid fovea. Because of its attachment into articular disc, we will go with lateral pterygoid as the correct answer, because excessive spasm of lateral pterygoid muscle can dislocate the jaw and displacement can occur beyond articular tubercle. So yes, now see here, actually this diagram will help you to understand this clearly. So here if you will see, okay, so in this diagram, okay, just focus. So here lateral pterygoid muscle has been shown, also the medial pterygoid muscle has been shown, but if you see the outline of lateral pterygoid muscle, I am showing you, it is having two heads. Okay, so this is the, see here, this is the upper head of lateral pterygoid muscle, this is the upper head of lateral pterygoid, LP for lateral pterygoid muscle. This is the lower head of lateral pterygoid muscle. Okay, lateral pterygoid muscle. Now, upper head of lateral pterygoid muscle, which is originating from infratemporal crest of sphenoid bone, and lower head is originating from lateral pterygoid plate of the sphenoid bone. Which aspect? Lateral aspect. And from here these two heads will join and these two heads are inserting. See here, these two heads are inserting in the pterygoid fovea. So this is having an insertion. The insertion of lateral pterygoid muscle is having in the pterygoid fovea, which is lying on the anterior aspect of the mandible bone, and also it is inserting, if you will see this diagram, you can understand, this is inserting into articular disc of TM joint and in the fibrous capsule. So it is inserting also in the fibrous capsule FC and articular disc of TM joint. Which joint? TM joint. So we will go with lateral pterygoid muscle as the correct answer. The other muscle which is also shown here is the medial pterygoid muscle. So this is the medial pterygoid muscle, which is, we have already talked about lateral pterygoid muscle and seen the origin insertion. When we are talking about medial pterygoid muscle, which is originating, it is having two heads of origin, superficial and deep, and this is the ramus of the mandible, inner aspect. So it inserts onto the inner aspect of ramus of the mandible, and medial pterygoid arises from, it is superficial part arises from maxillary tuberosity. Superficial part from maxillary tuberosity, and if we talk about its deeper part, the deeper part of medial pterygoid muscle arises from medial part of lateral pterygoid muscle. This is important to note that lateral pterygoid plate is giving rise to both lateral pterygoid and medial pterygoid, but lateral aspect of lateral pterygoid is giving origin to lateral pterygoid muscle and medial part is giving rise to medial pterygoid muscle. So directly, if we will, I am not going into detail of each and every muscle, but laterally here by seeing the explanation of origin insertion of lateral pterygoid muscle, it is quite clear that we will go with lateral pterygoid as the correct answer, because it is attached onto the articular disc of TM joint. So we have got the correct answer here, A, that is lateral pterygoid, for question number 20th. So is it okay? Done? Yes, my dear aspirants, let's move on to the next question number 21. Okay. An otherwise healthy student. So the student is healthy. No medication is concerned because he has noticed several painless, uniform, large bumps at the back of his tongue. These are most likely aphthous ulcer, candida colonies, circumvallate papillae or filiform papillae. What is the correct answer? Question number 21. Okay, please mark the correct answer. Your time begins now. Okay, so I got an answer from Amit. It's 21. Yeah, 21C. Yes, circumvallate papilla is absolutely correct. Absolutely correct, dear. So circumvallate. So actually, the key point which is helping us to approach to the correct answer is that the student is not taking any medication and he is healthy. The student is healthy, no medication is given. So all other aphthous ulcer, candida colonies can't be the right answer. And also he has noticed uniform paleness, large bump at the back of his tongue. So back of tongue is also mentioned. So filiform papilla can't be the right answer. So actually why we are telling that circumvallate papilla is the right answer, because the location of circumvallate papilla is in the posterior part of the tongue, and filiform papilla can't be the right answer because it is lying in the anterior part of the tongue, more aggregated in the anterior part of the tongue, and they are very small, large bump hai, so we will go with circumvallate. Location is also favoring. And aphthous ulcer, candida can't be the right answer because they are involved in immunocompromised patients. So my dear aspirants, firstly let me show you this diagram where all the location of papilla has been explained. So here if I go with this line, this is sulcus terminalis, okay, and this structure is foramen, FC for foramen cecum, that is the embryological aspect of the thyroglossal point, and here this foramen, this is sulcus terminalis, this line is sulcus terminalis. So anterior to sulcus terminalis, you can say very close to posterior part only, large bumps are seen. So this circular bumps which you are seeing is circumvallate papillae. So exactly because of the location we will go with circumvallate papillae as the right answer, because it is lying just anterior to sulcus terminalis. To be more specific, it is lying on the posterior most part of anterior part of the tongue, but it is lying very close to the posterior part of the tongue. Now this part is the posterior part of the tongue which is having so many of lymphatic aggregation. These are all lymphatic aggregation which is lying here, and this lymphatic aggregation is forming lingual tonsil. What does it forms? It forms lingual tonsil. So posterior part of the tongue is having lingual tonsils, and anterior part of the tongue is having foliate papilla, actually filiform papillae and that of fungiform papilla. In this filiform, foliate papilla is just rudimentary. It is just rudimentary in case of human beings. Filiform papilla is the most numerous one. It is very numerous. It is lying over the entire part of anterior part of the tongue, and also towards the margin and all we have got the fungiform which is mushroom in shape. It is the smallest one is filiform papilla. Actually the basic important point of filiform papilla is that it is having keratinization. So roughness is seen in case of tongue surface because of the presence of filiform papilla, because it is having keratin deposit, so it is keratinized. Rest all papilla are stratified squamous non-keratinized epithelium. Please note down, rest all papilla is non-keratinized except filiform papilla which is keratinized. Other than that, circumvallate papillae and fungiform papillae is having taste buds. They are also having taste buds, but this filiform papillae is having no taste bud. It is having no taste buds. So we have, in brief, we have done with the tongue, so that we have just revised the papillae. Now, what were the other options? Before moving on to the next MCQ, let me just give a brief about the other options. So first thing, oral candida can't be the right answer, candidiasis, because it is a condition of oral thrush and the candida infection happens, and this is the presentation. Can you see here? This is the appearance of the tongue which is seen in the patient of oral candidiasis. The oral candidiasis is a fungal or yeastal infection, and the whole of the mucous membrane of the mouth and the tongue is involved. Okay, and the patient or the student child which was mentioned in the MCQ was absolutely healthy. So we will not go with oral candidiasis as the right answer. Got it? Now my dear aspirants, let's move. So it is due to mycosis, yeast or fungal infection, oral candidiasis. The next option was aphthous ulcer or aphthostomatitis, that is inflammation. So it is oral thrush. It's a common condition which is seen in cases of, mainly it is seen in those person who are immunocompromised. Their immunity is less, they are immunocompromised. So actually aphthous ulcers. Stomatitis is a common infection of mouth ulcers, and it is seen in the formation of benign and non-infected mouth ulcers. See here, this is the location of mouth ulcer which is shown in the diagram. Okay. Generally, it is involved in those persons who are on medications or their immunity, they are immunocompromised. So, the cause is not complete, but it is due to T cell mediated immune response triggered, and the reasons are local thrash, local trauma, stress, genetic, food, dehydration, some drug abuse, and also it is seen in immunocompromised person. So, such kind of history was not provided in the MCQ. So, no history of medication, no history of illness was mentioned here. So, definitely because of the location, we will go with circumvallate papilla as the correct answer. Okay, my dear aspirants, let's move on to the next, that is question number 22. The only abductor of larynx is, the only abductor muscles of larynx is innervated by which nerve? Recurrent laryngeal nerve, inferior laryngeal nerve, internal branch of superior laryngeal nerve, external branch of superior laryngeal nerve. Which is the right one? So, first thing is, which muscle is the abductor of larynx? Which muscle is the abductor? So, actually in case of larynx, intrinsic muscles of larynx, we have got one muscle which is the abductor of larynx. What is the name of that muscle? 22. Correct answer for 22 number MCQ. Okay, so Amitabh has given the answer, recurrent laryngeal nerve. Okay, so yes, I just want to know the abductor of larynx. What is the name of the abductor muscles of larynx? Posterior cricoarytenoid. Posterior cricoarytenoid. Posterior cricoarytenoid. Okay. Posterior cricoarytenoid. Okay, the only abductor of larynx is posterior cricoarytenoid. A. So yes, so actually when we talk about the innervation of larynx intrinsic muscles, all the muscles are getting innervation from recurrent laryngeal nerve. Okay, except cricothyroid, which is getting innervation from external branch of superior laryngeal nerve. So let me show you. The only abductor of larynx is posterior cricoarytenoid, and the innervation of posterior cricoarytenoid is by recurrent laryngeal nerve. So, one of the important point is that all the muscles of larynx, all the muscles of larynx is getting innervation from recurrent laryngeal nerve. Recurrent laryngeal nerve, except cricothyroid. Cricothyroid is getting innervation. So, what is the nerve supply of cricothyroid? It is getting innervation from ELN. What is it? External laryngeal nerve. And we know that external laryngeal nerve is a branch of superior laryngeal nerve. Cricothyroid muscle is the tensor of the vocal cord. Posterior cricoarytenoid muscle is the abductor of vocal cord. These are a few things which is important for you to revise. Okay, so now we will move on to the question number 23rd. All of the following are branches of external carotid artery supplying nasal septum except. All of the following are branches of external carotid artery which is giving blood supply to the nasal septum except. So, which is the right one? Options are sphenopalatine artery, anterior ethmoidal artery, superior labile or greater palatine artery. Question number 23. Okay, Sai has given the answer B, anterior ethmoidal. Okay. So, yes, so if it is the correct answer, can you tell me anterior ethmoidal artery is a branch of internal carotid artery? Directly, anterior ethmoidal artery is a branch of ophthalmic artery, and ophthalmic artery is a branch of ICA, internal carotid artery. Now, greater palatine artery is a branch of third part of maxillary artery, and again maxillary artery is a branch of ECA, external carotid artery. Now, superior labile artery is a branch of facial artery, and again facial artery is a branch of external carotid artery. Facial artery is an anterior branch of external carotid artery. Sphenopalatine artery is a branch of third part of maxillary artery. It's a branch of third part of maxillary artery, and sphenopalatine artery itself is a branch of, and maxillary artery itself is a branch of external carotid artery. Okay, my dear aspirants, I would also like to show you a diagram for it where you can appreciate the blood supply of the nasal septum and how is the Kesselbach plexus formed and where is the Kesselbach plexus located. So, let's see. Yes, Aarti Pa, little area is right. Okay, see here. So, yes. Now, my dear aspirants, let me show you the diagram for it. So, see here you can see the diagram is showing you the nasal septum, and in the nasal septum, antero-inferior aspect of the nasal septum, we have got the location of Little's area. So, Little's area, we have got the location of Little's area in the antero-inferior part of the nasal septum. So, this is exactly the location of Little's area and the antero-inferior part of the nasal septum. Now, the important arteries contributing is, so you can see here the nasal septum Kesselbach plexus is formed by branches of anterior ethmoidal artery, branches of superior labile artery, branches of greater palatine artery, and branches of sphenopalatine artery. Here, and anterior ethmoidal artery, ophthalmic artery branch of internal carotid artery, okay, internal carotid artery. Sphenopalatine artery, branch of third part of maxillary artery, branch of ECA, external carotid artery. Greater palatine also the branch of third part of maxillary artery and branch of ECA, external carotid artery. Superior labile artery, branch of facial artery, and also the branch of external carotid artery. So, here you can see epistaxis. Yes, it is the cause of anterior epistaxis. Posterior ethmoidal artery is also giving blood supply. As you can see, posterior ethmoidal artery is also giving blood supply to nasal septum, but it is not taking part in formation of Kesselbach plexus. So, done with this? Okay, my dear aspirants. So, let's move on to the next MCQ. Okay. Now, okay, which of the following structure is generally referred as adenoid? Whether it is pharyngeal tonsil, whether it is submandibular gland, whether it is palatine tonsil, lingual tonsil, or sublingual tonsil. Okay. So, Sai has given the answer A. What about others? Amitabh Behra is also. Yes, actually it is question number 24 only. Yes, Amitabh is there since the session I have started is already going to be approximately 1 hour 45 minutes and he is okay, yeah. Yes, Amitabh Behra, it's okay. It's a 24 only, but I have wrongly mentioned it's 25. Okay, means one of the MCQ has slipped out. So, no worries. So, which of the commonly is, okay, pharyngeal tonsil is absolutely correct answer. Actually, adenoid is called as enlargement of nasopharyngeal tonsil. It is also called as nasopharyngeal tonsil. So, where the lymphatic aggregation which is lying posterior to nasopharynx, in the posterior aspect of the nasopharynx, you can see lymphoid aggregation which is called as pharyngeal tonsil, and it is generally seen more in the children till the age of 6 years. And if this nasopharyngeal tonsil enlarges, it forms adenoid, and if the adenoid is quite enlarged, it can obstruct the airway, it can lead to nasal twang to our voices, it can lead to epistaxis, and then an operation has to be performed that is called as adenoidectomy. So actually there is a ring of tonsil which is formed, that is called as Waldeyer's ring. What is that called as? That is called as Waldeyer's ring, and Waldeyer's ring is formed by 4 tonsil. How many tonsil? 4 tonsil. What are they? What are they? They are lingual tonsil, which is lying on the posterior part of the tongue. They are palatine tonsil lying in the palatine fossa, nasopharyngeal tonsil, and also tubal tonsil. What is tubal tonsil? The lymphatic aggregation above the opening of auditory tube. Okay, so let me show you. See here, we have got 4 types of tonsil. Yes, we have got 4 types of tonsils. These together is called as Waldeyer's ring. These together forms a ring at the opening of the oronasopharyngeal opening together, and they are very important for giving protection, and they are not letting any foreign structures or any infection to enter inside the oral or pharyngeal cavity, nasopharyngeal cavity. And we already have discussed that pharyngeal tonsil enlargement is called as adenoid. They are pharyngeal tonsil. Where is pharyngeal tonsil located? Close to posterior aspect of nasopharynx. Tubal tonsil above the opening of auditory tube. So if I enlarge this diagram, so let me just see. Okay, so you can see pharyngeal tonsil is lying pharyngeal tonsil is lying posterior to posterior wall of nasopharynx. Okay, tubal tonsil at the above. So this is the pharyngeal tonsil. This is the aggregation of pharyngeal tonsil. If you will see, this exactly is the aggregation of pharyngeal tonsil. Okay, this is pharyngeal tonsil. If you see lower down, this is the location just above the opening of auditory tube. This is the auditory tube. This is what? This is the opening of AT, that is auditory tube. Above that there is aggregation of lymphatics, and that aggregation of lymphatics is called tubal tonsil. So this is lying above the opening of AT, that is auditory tube. The third is the palatine tonsil, which is located in tonsillar fossa. So this is exactly the location of palatine tonsil. Okay, palatine tonsil. Palatine tonsil is lying between anterior wall and posterior wall, is formed by palatoglossal arch. So it is what is the location of tonsillar fossa? Tonsillar fossa is having anterior wall which is formed by palatoglossal arch, and its posterior wall is formed by palatopharyngeal arch. And in the posterior part of the tongue we have got lingual tonsil. So posterior part of the tongue is having lingual tonsil. Got it? Okay. So yes. So done with this. Now my dear aspirants, let's move on to the next. So what happens when there is enlargement? If you will see the case of enlargement, when we are talking about the enlargement of the nasopharyngeal tonsil, it will enlarge, it will lead to the obstruction of nasopharynx. So see here in this diagram, for example, this is the lateral wall of the nose. So this is this is the lateral wall of the nose, and here on the posterior aspect they have got nasopharynx. We have got the nasopharynx, and in the posterior aspect of the nasopharynx, if the opening is obstructed by this enlargement, this is adenoid, this will lead to mouth breathing. In this is generally seen in case of children up to 6 to 7 years of age, and if it is enlarged, it will cause mouth breathing in that person, in that children, and they will have also difficulty in breathing. Nasal tongue is to their voice, and they have also complain of epistaxis and bleeding. The ultimate treatment will be removal of the nasopharyngeal enlargement. Adenoidectomy is the treatment. Okay. Okay, my dear aspirants. So is it okay? Now, it's also important that before ending the session, certain important points which I want to tell about my upcoming session. So free special class. So on Sunday, that is 30th of January, I am taking free special session. So do join this free special session. So high yield anatomy MCQ series will be taken targeting for NEET PG 2022 examination. These all MCQs will be high yield anatomy MCQs. So do present live. Very good evening, ma'am. Okay, just a minute. I am coming to you, Renuka More. So I will come to you, Renuka More. Just a minute. So on Sunday, 30th of January, 1 p.m. and 2 p.m. is the timing where you can be present 30th January 1 p.m. and 2 p.m. You can be present for this free special session. And also the students who are watching the session for the first time, they can use my code NAT10 for unlocking the free session after downloading the app, that is Unacademy app. They will find their goal as NEET PG and they can use this as an unlock code. Okay. So yes, Renuka Moore, very good evening ma'am. I am a nursing student looking for anatomy physiology class as well as psychiatric class for IR NORCET 2022. Can you please guide me if you have a short time? So yes dear, so you can also be the part of many of my MCQ sessions, like if my MCQ sessions are targeted for gross anatomy, you can be the part. Okay, Renuka Moore. So physiology and that about anatomy is already on the platform here. You have to download the Unacademy app and thereafter you have to find your goal as NEET PG. Don't get worried about NEET PG. Actually, many sessions are there on the platform of Unacademy. Thereafter, you have to choose which all topic is targeted for your examination. Okay, if you want to have a conceptual study, Renuka Moore, you can see the conceptual theory part which is there on the Future Doctor Unacademy. So Unacademy Future Doctor Unacademy Future Doctor YouTube channel is there, where I am taking the sessions of anatomy in a primitive way and in a very conceptual way, so that each and every students can get benefit from that. So you can join it. And also I am not telling that you will be for my fast track revision of NEET PG and all, but few MCQ, there is always an overlap of MCQs. So you can, if you have got a time, you can be present live. Few MCQs which are at a difficult level and more targeted for INI, CT and NEET PG is not necessary for you, but all gross MCQs are overlapping. So you can be the part of that. Yeah, thank you so much Amit Behra. So Renuka Moore, is it okay? So that for free session you can download the Unacademy app and you can use my code NAT10 for unlocking any free sessions of the Unacademy. So for it you have to download the Unacademy app, dear. Now my dear aspirants, I would also like to share, so please see, this is the whole timetable for the free test calendar of Unacademy. So here you can see the free test calendar targeting for NEET PG examination. And my dear aspirants, 30th Jan there is free test for FMG 22 grand test. So all of you do present and enroll in this free grand test. You can use my code NAT10 and can enroll for this free grand test by using this code. So just go for it. It will be highly beneficial. It would be highly beneficial for you. Okay, my dear aspirants. Now, this is the pricing detail of Plus and Iconic has been shown to you. The comparison has been done so that it will help you to guide which subscription you have to take. If you are a student of first or second year, definitely you can go for the subscription of 3-4 years. You can have comprehensive course where you can complete your university exam with a good mark. Your Viva will be cleared. Along with it, you can prepare for the next exam. Okay, so aspirants of aspirants of NEET PG, aspirants of INI-CT, so definitely go for Iconic subscription. Okay, you can use my code NAT10 to get an extra discount of 10%. This will be highly beneficial. I would also like to tell the students, do join the special free sessions, and tomorrow also I will take a YouTube session, that is FMG. Today also I am taking 6 p.m. session and tomorrow also I am taking one more session. So YouTube may abhi 2 more sessions are there. My next session is for targeting for FMG June session 2022. 2 sessions I am taking, one at 6 p.m. today and another is tomorrow. Which I am taking tomorrow session. So if you are interested, you can be present live for this session. This will be highly beneficial for you. Okay, my dear aspirants. And also, if you are seeing the sessions on the special class free platform of Unacademy, you can also download the PDF notes. That is highly beneficial for you. So my dear aspirants, before ending the session, what I want you to tell, that if you want to study anything conceptually, I have started already the course of anatomy from very basic in the Unacademy Future Doctor YouTube channel. You can join there. Yeah, Renuka, thank you so much. Thank you so much. Okay, and there is more of upcoming upcoming features are coming out on the Unacademy platform. So I will soon come up with that, where the aspirants and students can have one-to-one interaction with the educator. After the YouTube session is completed, we will have a session of 10 to 15 minutes and we can directly talk on the phone. So that communication is open house communication is again coming up. So I will just let you know in the coming days how we can get connected. So whenever there is a session, I will also proceed that session with a 10 to 15 minutes of communication, where the students can let me know which was their actual doubt of the topic and what else they want to know, how they have to proceed for that study. That is again another important features. So before ending the session, thank you. Do like, subscribe the Let's Crack NEET PG platform. All the best. Thank you so much. Thank you, my dear aspirants. Thank you. I hope the session was useful for you. Thanks, dear.